Amyotrophic lateral sclerosis, or Lou Gehrig's disease, is a progressive neurodegenerative illness occurring when a muscle no longer has any nourishment and consequently wastes away. As this area degenerates, it leads to scarring or hardening, sclerosis, in the area and motor neurons, the nerve cells found in your brain, spinal cord and muscles decay. As motor neurons degenerate, they can't send impulses to the fibers that usually triggers muscle movement. When muscles no longer receive the messages that they require to function, the muscles begin to look thinner as muscle tissue shrinks. This ultimately leads to death, as the decay of the motor neurons means the brain's ability to control muscle movement disappears. However, to be diagnosed with ALS, people must have signs and symptoms of both upper and lower motor neuron damage that cannot be attributed to other causes. Early ALS symptoms can be subtle and may often be overlooked. There are two forms of onset ALS: bulbar onset and limb onset. Bulbar onset means the patient first notices speech problems, as opposed to the more common limb onset, where the earliest symptoms of ALS are noticed in the limbs, such as stumbling often or having issues with manual tasks. Although the sequence of emerging symptoms and the rate of disease progression vary from person to person, eventually individuals will not be able to stand or walk, get in or out of bed on their own, or use their hands and arms. Swallowing and chewing becomes harder, which disrupts the person's ability to eat and increases cases of choking. As the patient's ability to eat worsens, maintaining a healthy weight can become an issue. Because cognitive abilities are comparatively, besides a small group who may struggle with memory or possible dementia, intact patients may become anxious and depressed due to their worsening physical condition. Symptoms of upper motor neuron involvement include muscle stiffness and exaggerated reflexes, particularly on overactive gag reflex. An abnormal reflex, commonly called Babinski's sign, where the large toe pulls upwards when the sole of the foot is stimulated in a particular way, also suggests upper motor neuron damage. Symptoms of lower motor neuron degeneration include muscle weakness and atrophy, where the tissue wastes away, cramps, and twitching. As the disease progresses, individuals have difficulty breathing as their respiratory system weakens. They eventually lose the ability to breathe on their own and must depend on ventilatory support machines. While there is not a treatment that halts or reverses ALS, there is one approved drug called riluzole that slows the progression of ALS, as well as several other drugs in clinical trials that show promise. There are also significant therapies that can manage the symptoms of ALS that help people maintain a level of independence and prolong life. ALS, as it stands,